If you have an allergy, there's 50% chance that your child will have a sort of allergy too. I'm Zainab. I'm the pharmacist from PillSorted, and I'll cover why allergy runs in the families, how do we test for them, and what are the best treatments out there. There is a lot of evidence that shows there is a huge genetic factor to allergies. What that means is, if a parent has an allergy, be it hay fever, be it eczema, be it food allergy, be it asthma, there's a 50% chance that the child will develop a form of allergy. It might not be the same as the parent one, but they will have a sort of allergy. If both parents have got an allergic reaction, that chance goes up to 70%. What that means is you inherit the immune system that is quite sensitive, that can start reacting to things that are not really harmful, like pollen, dust mite, certain foods, all of these. But the important thing is you won't inherit exactly the same allergy as your parent. So your parent might have had eczema, but your allergy will show as food allergy. Or you have hay fever, whereas none of your parents had hay fever, but they had food allergies. So that's why when it runs in the families, it's really important to get tested, because you might not know what you're allergic towards. As a pharmacist, these are the things that when I hear, I'll be encouraging you to go and get a allergy test done. So if you say that certain times of the year you get runny nose, swollen eyes, itchy ears, that would be one symptom. The other one is if you've had a food and you don't know why, but something upsets you in that food. Or if you say that I've had a rash come up and I really don't know why, that could be another thing. And usually I'd be asking from you that, have any of your parents had hay fever? Have any of your parents experienced anything like that? How do the tests work? It's called a skin prick test. It will be like a film, and on that it has a tiny amount of the most common allergens, so like dust mite, like grass, like tree pollen, like pet fur on your forearm. And then we wait. If after 15 minutes we see swelling around any of those, that shows that your body is allergic to that trigger. There's more specific tests as well, so they will look for specific immunoglobulin E's, the IgEs, for that item, and that would be used for more severe cases, like if there's a severe eczema and we want to make sure we find out what are the causes, we could run those specific blood tests. And sometimes we do patch testing, so if it's a contact allergy, so some people will get allergic reactions if they have certain metals contacting their skin, like nickel. So now I'm going to cover how we treat it. The first step, and by far the most important step in treating any allergen, is actually avoidance. If you're allergic to dust mites, use anti-allergy mattresses, pillows. Make sure that you vacuum regularly. Have as minimum as possible of soft furnishing, not too thick of a carpet, or least carpets as possible, and wash everything with over 60 degrees so the dust mites can't live. If you've got a pet allergies, make sure that you use HEPA filters in the home. Try to keep the pets out of your bedroom, and again, hoovering regularly is really important. So if you've got allergy to pollen, make sure you've got an eye on the pollen count per day, and keep the doors and windows closed when it's the high pollen count. Okay, so usually in the evenings is when the pollens are the highest. Make sure that the doors and windows are closed at that time, and again, as much as you can, mop everywhere. Make sure that there's not pollens around on any of the surfaces. Another thing that can help a lot is when you come home from outside, take a shower, because that'll take all the pollens off your body. If you've got a food allergy, it's really good to keep a note and check the food labels really carefully. Avoidance is by far the best medicine. Now we'll go into the medicine treatments that are out there. Our first line is always antihistamines. There are two generations of antihistamines. The older generation of antihistamines can cross the brain barrier and they can cause drowsiness. One of the most important ones of them is chlorpheniramine. Chlorpheniramine is really good, especially if the itchiness and swellings are affecting your sleep. It really helps you fall asleep, but it's short acting, so it will work only for around 8 hours. So you do need to take it again, like 2 to 3 times per day. The second generation of antihistamines don't cross the brain barrier, so they don't cause drowsiness, and they're longer acting. So there's a couple of different ones there. There is the cetirizine, there is the loratadine, and there is fexofenadine. So these are the 3 most common antihistamines. I'd suggest bulk buying these and having a lot of them, because again, if allergies run in the family, you'll see you're gonna run through a lot of these quite fast. It's not a bad idea that change them as well. So if you've had a couple of months of cetirizine and your allergies are ongoing, change it to loratadine, change it to fexofenadine, so that could bring better reaction than always keeping on the same one. But again, these can be person by person. There is the acrivastin as well. It is short acting, but it is from the newer generation of antihistamines, so it doesn't cause drowsiness. Another important thing is, if you know you have a specific allergy, so if you have hay fever and the hay fever season is coming up, start taking the antihistamines at least 2 weeks ahead of having an encounter with that. We've got some treatments for the local effects as well. So if there's itchy skin, one of the best things to work on is steroid creams. There's lots of different kinds of steroid creams. Steroids are really good, they're really effective, they help reduce the swelling, but you can't use them for too long. So if you see that you're having to use steroids for too often, it's the time to ask your healthcare professional, our pharmacist, what's the best option for you. It might be that you need a round of oral steroids, and that'll help it clear up faster than carrying on with steroid creams. Another option are antihistamine creams like this one. These are local antihistamine ones, again, are quite good to relieve itching or swellings that have come up for a sting or an insect bite, and they will help calm down the local area. Now, eye drops. One of the reactions of histamine is it makes your eyes really teary. There is a medicine called sodium chromoglycate. The good thing about sodium chromoglycate is it'll stop the mast cells from exploding, so it won't let the histamine get released that way. There is local antihistamine eye drops as well, like azelastine. Again, both of these are available from the pharmacy. They can help reduce the effect of the histamine. Now let's move on to nose. These are both steroid nasal sprays, and they will help reduce the constant inflammatory that happens in the nose. Some people get a better effect from one versus the other. Again, it's like the antihistamine tablets. It's not a bad idea to try different ones. Again, the other important thing is it takes time for them to start affecting. So if you're using a steroid nasal spray, you need to use it at least 2 weeks to see the full-on effect. Another option are these. This is a decongestant nasal spray, and they can help relieve congestion very quick actually, so they work faster than the steroid nasal sprays. However, you can't use them more than 3 days because they cause rebound congestion if you use them for too long. And one of the most underrated but very effective items is a sinus rinse. This is just isotonic saline, but it's extremely effective to help clear up all of the nasal passage. The thing is, when the nasal passage is clear, it'll have a great effect on having less mucus, so less coughing, less pain and congestion around all of your ears and eyes and nose. So it's really good way to make you feel better, and if you use it especially at nighttime, to sleep better. I'm going to go into the strongest medications that we have for severe allergic reactions, and that is in adrenaline. These are lifesavers. So when there is a severe allergic reaction, you just have seconds to react, and these are very strong medications that even work over clothes and they're easy to inject. When there's a severe allergic reaction, the important thing that we want to do is to reverse the histamine's effect on the smooth muscle. So basically, they will affect how you can breathe, so they can make you choke and they will make you lose consciousness really fast. So we want to reverse that, and the best thing that we have is the adrenaline. I will cover how to use the different kind of adrenaline injections like the EpiPen and the Jex in a separate video, but it's a really good and important one to learn so that you can be able to support your loved ones or yourself at important times. Okay, and the last thing about treatment is the immunotherapy, which actually tries to desensitize your body towards that allergen. It can be offered by different clinics under the NHS as well, and it involves giving that tiny amount of the allergen and gradually increasing it so that your body gets retrained and tolerates that allergen. Just a couple of things that are important. So if it's a mild allergy, like a hay fever, like a skin reaction, like an insect bite, usually we've got all of those available in the pharmacy so that you're able to help yourself. If the symptoms are not controlled by things over the counter, or if it's like carrying on for too long, that's the time that is better to have a consultation with the doctors, because it's better to get more blood tests done. But if you have any signs of breathing difficulty or collapse, so falling to the ground, those are the times that are emergency. And even if you use the EpiPen, it's still better to call the emergencies to make sure that you're okay, because the symptoms might come back again. As a recap, allergies run in the family. It's good to get it properly tested so you know what to avoid. There are lots of different treatments out there that can help you feel better. This video is part of our Allergy and Hayfever series. If you've got any questions, feel free to reach out to us for that safe clinician-led advice. Thank you.